One for Mum, one for Dad, and one for the country.
And there has never been a more exciting time to be an Australian.
Budgets are about choices, Fran, and you show what you value through the choices you make.
This is coal. Don't be afraid. Don't be scared. The Treasurer knows.
I want an economy that works for people, not the other way around.
We'll just end up being a third-rate economy, a banana republic.
Just follow the money.
G'day and welcome to Follow the Money, the Australia Institute's podcast that explains big economic issues in plain English. I'm Ebony Bennett, Deputy Director at the Australia Institute, and in this episode of Follow the Money, we'll be listening back to an interview I did as part of a series of webinars hosted by the Australia Institute's Nordic Policy Centre as part of Nordic Talks. Nordic Talks brings together experts to discuss global challenges with a focus on Nordic policy. In Denmark, the bicycle has been recognised as a fast, efficient and sustainable mode of transportation for decades, and the key to more livable cities and happier, healthier people, supported by a network of safe cycling infrastructure and a positive cycle culture. It's part of healthy urban design, which also means fewer food deserts in cities. In Australia, our bicycle infrastructure is far less inviting and far less safe, resulting in higher transport emissions, impacting the health of our communities and leaving people at the mercy of cars and high petrol prices. Enabling more people to cycle and walk as an everyday means of transportation is vital to reducing emissions and improving public health. And to talk about this, I spoke with Marianne Weinreich, Market Manager at Ramboll Smart Mobility and Chair of the Cycling Embassy of Denmark, and to Dr. Sandro De Maio, Chief Executive Officer at Vic Health. Thanks very much. I'm delighted to introduce our speakers for this evening. Our topic, of course, is peddling health, healthy and sustainable cities in Denmark and Australia. And tonight we've got two fabulous guests. Marianne Weinreich is Market Manager of Ramboll Smart Mobility and Chair of the Cycling Embassy of Denmark. Marianne holds a Master's in Scandinavian Literature and Language and World History, but for more than 20 years, she has advised cities about sustainable mobility policy, promotion and mobility management. She's an expert in cycling policy and promotion. The last 5 years, she's been market manager in Ramboll's Smart Mobility division, where she, besides working with clients, is leading the Thought Leadership Program. And she's also co-founder and chair of the Cycling Embassy of Denmark and a very experienced speaker and moderator of cycling and mobility webinars and conferences around the world. We're very lucky to have her. Thank you so much for joining us this evening, Marianne. And
thank you.
Dr. Sandro De Maio is the CEO of Vic Health and a globally renowned public health expert and an experienced researcher in Nordic nations. He's an advocate as well as being a medical doctor with a passion for food, health and well-being. His extensive background includes being the medical officer for non-communicable conditions and nutrition with the Department of Nutrition at the World Health Organization, as well as being CEO of the EAT Foundation. He does a lot of pro bono work and has published 30 scientific papers and more than 90 articles. He also co-hosted the ABC television show Ask the Doctor and more recently appeared on Magda's Big National Health Check on the ABC as well. He holds a Master of Public Health, a PhD in non-communicable diseases, and has held fellowships at both Harvard Medical School and Johns Hopkins School of Public Health. Welcome, Dr. Sandro De Maio.
Thank you.
Marianne, if I can begin with you, Denmark is really a world leader when it comes to active transport and cycling in particular. I just wondered if you could begin by painting us a picture of what that looks like in terms of everyday life and a few of the key things that Denmark did to kind of encourage that culture and work for the infrastructure and things that go with it. How does that look, everyday active transport and cycling in particular in Denmark? Just paint a picture for us to begin with.
Yes, thank you. But first and foremost, I would just like to start by saying that Danes don't cycle because we have some special cycling gene or care more about the environment than everybody else. We cycle because our cities and communities are designed for cycling and walking also to some extent. And so that means that in our streets we have protected bike lanes that keep you separated from cars and from also pedestrians. We have bicycle parking also available everywhere. And that means that it is possible for you as an individual to go from anywhere to everywhere on a bicycle, that it's a coherent network and that it doesn't suddenly stop. And it's a mix of protected bike lanes, painted lanes, or mixed streets, but it all depends on the volume and the speed of the cars there. So that means that we have, for instance, in the middle of Copenhagen, Queen Louise's Bridge with daily 40,000 cyclists. That means that there can be congestion on the bike lanes at the intersections, and you will see huge swarms of people on bikes in rush hour in Copenhagen. And what you see is different ages, both men and women. We have a 50% men and women cycling. And you also see that people will dress for the destination, not the ride.
Yeah, that's something that I'd like to explore a little bit further as someone who doesn't cycle to work as often as I would like. That's one of my key things apart from safety. But Sandro, the public health implications of having a city that's so welcoming of active transport and has encouraged such an amazing culture, the health implications of that must be enormous. Can you just lay that out for us a little bit?
Yeah, they are absolutely enormous. So I spent 3 years living in Denmark, a wonderful country. And, I always like to use the comparison of Denmark to Australia, or at least even Victoria, because they're similar then population scales as well. So Denmark and Victoria roughly have the same population, around 5-6 million, give or take a million. They have a similar GDP, very similar genetics, because of the Vikings going back and forth to the UK for 1,000 years, and yet they have an obesity rate half of Australia. And so you think, well, how can a country with a similar level of wealth, very similar, in terms of modern democracy, very open democratic societies, very progressive societies, how can they have such different levels of obesity and, of course, chronic disease? And much of it goes back to important social policies, including the way that the cities, and certainly not just Copenhagen, but particularly Copenhagen, are designed. And you compare that to Australia, Melbourne, a city of roughly 5 million people, only about 2% of people take a bike to work or use it for their daily commute. 3% of transport trips within the city are made on a bicycle. We know that only about a third of children, less than half of Australian adults, get the recommended amount of physical activity. And over time, we've seen, while we haven't seen significant changes in physical activity, we've certainly seen an increase in sedentary time. And we know that those things are then associated with, things like a healthy weight, but also chronic disease, and certainly related to the fact that 1 in 2 Australians live with chronic disease, and the average Australian will live with 11 years of pain and suffering at the end of their life from diseases that we largely know how to prevent. And it goes back to those social policies of how we design our cities, and not just cycling, but also looking at things like food access and affordability, housing quality, and all of the flow-on factors that come from, thinking about health when we design our cities.
Mayen, coming back to you, you've talked a little bit about what some of that great cycling infrastructure looks like. So the separate lanes or the painted lanes, that it's continuous, those types of things. But I really was struck by what you said about, even the ability to dress for where you're going and not for the cycle that you're going to take to get there. So if I just think about myself, you want to get to work in the clothes that you're in, not all hot and sweaty, for example. And I know, you were talking about people can go from anywhere to everywhere. So that includes, I'm thinking, the kids going to school, going to get your groceries, like all kinds of transport. Can you just take us a little bit into what it takes in terms of policy to deliver those kinds of outcomes, if that's the aim that you're going for?
Yeah, I just want to say, it's not paradise. We also have challenges when it comes to cycling.
I was waiting for the Dane. I was waiting for the Dane on the panel to say that. They're so humble. It's always the first thing the Dane says. We're not perfect. We're not perfect. They are.
But no. But I think it's important, to understand that a holistic approach where you address many different issues at the same time is important. It's not just about having the safe, protected infrastructure. It is a backbone, but it is not everything. It is also about, again, designing, welcoming people on bikes everywhere in the streets, in buildings, for instance, that if you go to work by bike and you feel that you don't want to be sweaty and you want to take a shower, that you can hang your clothes, that you can change if that's what you want, even though many Danes ride in their regular clothes. But we are also seeing now that with e-bikes that we are flattening the hills. We are making it possible to ride longer, to commute longer, because on the electric bike, you don't get that sweat, but you get the exercise, which is, of course, the health, important to your health. So by welcoming in the design of our streets, our buildings, our communities, and then also making sure that, for instance, many different types of bikes are available, that it's not just racing and mountain bikes, but it is what I call bikes with low entrance. Also, some call them women's bikes, but it's not about that. It's about you don't have to swing your leg up. And that means that you can wear skirts and heels. And you could also, as a man, just sit up and, be kind of Dutch cycling, and offer all these different types of bicycles so that people can also choose a bicycle that reflect who they are, like we choose clothes or cars or things that reflect who we are. So you can have cargo bikes. That means bicycles with huge kind of boxes in front of you where you can have your kids, take them to kindergarten, or you can do your grocery shopping. You can take home the Christmas tree, move furniture. It means basically that you can live a car independent lifestyle without losing out on in your everyday life on things you need to do.
So, Sandra, coming back to the Australian experience, being able to lead a car-free lifestyle sounds heavenly to me, given how much petrol prices have spiked in the last year or so. That is a huge consideration for people as a cost of living issue, let alone the public health and the kind of the climate impacts of that. What are some of the things that Australia needs to be looking at changing if we're going to get closer to the type of culture and active transport cities that that Denmark enjoys?
Yeah, look, it is a huge challenge, but it's also an enormous opportunity. It's not going to happen. I know these sound like almost political cliches. It's not going to happen overnight. Fundamentally, we're talking about sort of a rethink of the way of many parts of the way we design society, and with that is going to require. So first of all, it's to acknowledge, as you mentioned, so many of those incredible co-benefits. So climate co-benefits, air pollution co-benefits, but even health and social connection, mental well-being, so many possible co-benefits that will have enormous returns on the social fabric as well as the economic opportunities for Australians. The challenge is that it's going to take kind of multiple actions across different parts of government. Because if you think about the Danish example, so there's the planning perspective of the lane, bike lanes that are protected, not going down a bike lane as we do here in Melbourne, and there's 300 meters of bike lane, and then suddenly it just stops, and you're meeting sort of a car.
Mayan, I'll come back to you while Sandro checks on his internet connection there. I wanted to ask you in particular about the gender implications. And you were talking about that there's a 50-50 women and men riding, and that's kind of that women are, I think, an indicator species. I've read in some of your articles about how safe and welcoming in particular cycling is. Can you just tell us a little bit more about why that's important and what you've learned about that?
Yes, and actually naming women an indicator species for cycling is actually the Australian researcher Jan Girard who has done that, and what she explains is that women in general in life are more averse to risk than men. And when it comes to cycling, that means that traffic safety is just paramount. It's core for women when deciding if they want to be on a bicycle. And also women, to a greater extent than men, accompany children when traveling, and also to a greater extent than men do so-called trip chaining with multiple stops when you're traveling. It's not just A to B, home to work, for instance. And so there's a lot of grocery shopping and things like that. So it can be more complex. And with all this in mind, that means that there has to be safe infrastructure in place for women to take up cycling. But then when it's there, it actually really supports those shorter trips with multiple stops, because it makes it easy, because it's much easier to park a bicycle than a car. It's cheaper, it's much more convenient when the facilities are in place. So including women in policy making and design and catering for women's needs is really core in what we call normalizing cycling. Because I think that's one of the big differences, that in Denmark, cycling is just so normal that we don't even think about it as a thing. And when people learn that I literally traveled the world to talk about cycling, they go, what? Who wants to hear about that? Because it's just something we do. We get on the bike to go on a date or go to the movies, or we also drive a lot in Denmark. It's not that, but it's just that everybody cycles at some point, some more than others, but it's just part of our everyday life in a different way. And to get there, including women, working with children, and that children learn from very early age to have fun on a bicycle in a car-free setting. It's just, and learn the motor skills and the balance and the joy of cycling is just something that is part of our kindergartens. It's part of what you do as a parent. You teach your child how to walk, and then the next step is get them on a small bicycle at 2 years old with no pedals, and they just go wee, and then you're just as proud the first day they bike with no training wheels. It's just part of growing up, and but we need to protect that also now, and continuously have focus on that. So for me, it's about making the bicycle and cycling part of your life from early age to the late stages in life. So you can also, and even in Denmark, there's two women that created a funeral service, a hearse service with a bicycle, a huge cargo bike that can carry a hearse, and then people have their last ride on a cargo hearse with their families cycling behind them, and that's how I want to have my last ride in this world. Yeah, that for me is a livable city where you can end your life like that.
That's right. So Sandra, coming back to you, you were talking about, we've still got to overcome some of those things where like cycling lanes just kind of disappear mid-road, and some of the other ways that Australia can improve where we're going.
Yeah, look, and I think ultimately, Mariana's put it well. It's about shifting the norms, shifting the culture. It's fundamentally rethinking how we structure society and what we want to be the kind of path of least resistance. Because, as Mariana said, Danes aren't uniquely different. They didn't just wake up one morning and decide to take a bicycle. There are not only laws around. So, for example, in Australia, our planning laws in Victoria don't allow you to take health into consideration. So we've got towns in Victoria, country towns in Victoria, that can't even keep a fast food outlet out of their town, let alone build bike lanes. Because while, there are social elements and there are economic considerations in planning laws embedded in the legislation, health is actually not a consideration that's admissible. And that needs to change. The idea that you can't build a pharmacy within 5 kilometres of another pharmacy by law, but yet you can build as many fast food outlets as you want. Denmark has gone so far as looking at, well, what is the density of fresh food outlets? Everyone should live a certain distance from a fresh food outlet. When we're designing our cities, that should be mandated. That leads to a different incentive for business. It means businesses are incentivized to build smaller stores more often. It creates more competition. It allows you to pass a supermarket on the way home. And then not only do they marry the bike lane infrastructure with the early education, with with the urban design and medium density living, so that you're actually not trying to commute very long distances, and your commute distance is not directly related to your income. But also they then look at things like fiscal policies to match that. So, how do you use fiscal policies like taxation to incentivize people to take their bike over a car, or to stop and shop for food on the way home instead of takeaway? And so it's the combination of the planning policies with the social policies with the fiscal policies. And at the end of the day, there's free choice, absolutely, but you're kind of helping people to make that healthier path more possible, aspirational, and the path of least resistance. The big challenge we have in Australia is that fundamentally cycling has become a pastime of the rich, really, let's be honest. It's kind of the new golf, and it shouldn't be. It should actually be democratized and open for the benefits, the health and economic and social benefits, to be felt by people from all economic backgrounds. But that again requires, decisive decision making from government to, around density of living, around planning policies, around even, how we provide incentives. So in Denmark, many of the major headquarters for businesses, they're not in the centre of town. They're outside in the countryside. And so everyone's not commuting into the centre of Copenhagen every day, let alone on their bicycle. They're also, commuting to other parts of Denmark. So it's a combination of these different things. And I think one really important opportunity at the moment, if we're really serious about flattening the economic gradient of access to and the opportunity to feasibly enjoy better health through active transport. The big conversation around the wellbeing economy here in Australia at the moment, I think, is an opportunity, because what that conversation is about is really core to this conversation. It's how do we measure progress in society beyond GDP, beyond solely economic terms? And as soon as we start measuring, the prosperity of our cities based on health or on ability to commute safely and actively, regardless of your income or your postcode, or air pollution, as soon as we start using some of those measures as measures of progress and not simply economic measures of progress, then our economy will start pushing us in this direction as well. And there'll be opportunities for businesses in ways that we haven't had. And that carrot and stick scenario will start to emerge as it clearly has in Denmark and led them down this path.
Yeah, that reminds me of a couple of things. So number one, the Federal Treasurer, Jim Chalmers, has been looking into how the budget can better reflect not just fiscal policy, but other indicators of well-being. So that's kind of, I feel like, going to be an ongoing project at the federal level that starts to take into account some of those other well-being indicators. But it's such a good point about even things as basic as planning laws and not being able to rule out, fast food coming to town, that kind of thing. But it did also make me think even cities like Canberra, where I live, which has a pretty good network of bicycle paths, but is really a climate leader across the country as well. It's 100% renewable. We've got good incentives for example, e-vehicles, but I don't think there's any incentives that apply to e-bikes, for example, as an option for people. So there is, as you said, a huge amount of opportunity there for people. But I did just want to come back, Sandro, to I guess the kinds of cities that we want to build in Australia. And we've had this idea come up in recent weeks about a 15-minute city where you can get access to all kinds of different services and the ability to work and do all kinds of things, see the doctor within 15 minutes of wherever you are. And the idea that we can start to do these things differently and make different choices, and that it is really about opportunity. And, the things that we've described, the opportunities are almost endless and no downsides really to pursuing them either.
Yeah, and look, there are some great comments in the chat as well. Stephen's made the comment, 50% of trips in Melbourne are less than 5 kilometres. So there is a degree of local living that I would be guessing does have an equity lens to it, that lower socioeconomic communities probably face longer commutes. I think that's a fairly accepted concept and does come with it some significant challenges. But how do we use the current conversations around climate, a wellbeing economy, and the cost of living to start investing in some of these other areas and make it possible? It is through ultimately it's build it and they will come type mentality. I think it has to be for bigger cities like Melbourne, that if you can't safely cycle and you're sharing a road with cars and bike lanes suddenly disappear halfway, then it's a non-starter. It's not even an option. It's not about a choice for the individual. It's simply not an option. There probably does need to be, it's a bit chicken and egg, but I think we do need to kind of, probably in certain city contexts, invest more heavily, look more seriously at how we design cities and what priority we put to active transport infrastructure versus other forms. I think also there's a lot more we can be doing in Victoria, and there are some important conversations around public transport, which is certainly part of the solution. And even Denmark, I think the other part that struck me was the interconnected nature. You can put your bike on the front of a bus, and that's quite acceptable. You can take your bike as a child into the bus. So it allows then for these slightly longer trips or more complicated trips to be kind of possible through mixed means. But this is not my expertise. Certainly from a health perspective, it makes a lot of sense. The challenge is, as always, people want roads because of congestion now. It's hard to sell, I think, a narrative of something that will help longer term. But I think Australians are up for that conversation, and particularly if we can link it to some of the big challenges that were clearly on the minds of Australians as we went to an election only 12 months ago: climate change, cost of living, and greater conversations around well-being, and the way we design our cities and incentivizing or making it possible for people to take those 50% of trips on a bike or by foot without feeling unsafe or putting themselves and their families at risk. That's a huge health opportunity.
Go for it, Mayan.
Can I? Because I just want to add that decades of car-centric city planning has put us in the situation we are in right now, that we have air pollution that is killing people and making people sick. We have noise that is making people sick. Sitting is the new smoking. We have just created and designed our world we are sitting all the time. And then we are moving in our daily lives to a high degree by sitting in a car. And we have climate change because of CO2 emissions. But the bicycle is actually like a Swiss Army knife that can address all these issues. It's active travel, so it's healthy. It's no noise. There's no pollution. There's no CO2. And also it is affordable and a very democratic means of transportation, because there's also an equity issue here, that you're basically forcing people to spend a huge amount of their salary or income in general on a car. And that also means that we got to switch the priority and talk about, not about, the car, but about what kind of community, what kind of city do we want, and how do we want to support the good life, the healthy life. And we can certainly do that by the way we design our cities, but also, of course, through policies that nudge and incentivize and also makes it harder or more expensive to do the non-healthy, but also for congestion. Actually, when it comes to congestion and transport, cars are super inefficient because we are usually just one person in that huge car, and they're getting bigger and bigger. And so they take up an enormous amount of space in our cities, and space is a very scarce resource. So, and you can have 7 people on bikes in the same amount of space as one car. But we also need to, besides design and policies, support this. And I think that I saw a comment also about the perception of what a cyclist. I usually say people on bikes because I really don't want to use the word cyclist, because in other parts of the world, like Australia, like UK, where I'm right now, there is this extremely negative perception and connotations linked to the word cyclist. See a specific type, and we need to work with that and broaden that. And the more people walk, bike, and drive and use public transport in their daily lives, it also becomes less, conflict between the different user groups. If you switch, from day to day or during the day, what you are.
Because of course in Australia, probably most people on bikes also have a car. That's not mutually exclusive by any means, but there is certainly a lot of hostility. And in terms of the culture and making it fun, it's really lovely being on a bike on a lovely summer's day with a bit of breeze in your hair, and there's a lot to be said for it. And it's not just the Nordic nations, of course, that have other ways of doing things. I was in Portland a few years back, and they have a policy of right in the middle of the city, all cars give way if you're trying to cross a road for pedestrians. So I was waiting to kind of cross the road and all the cars stopped on either side. And I was like, what is happening? It took me a while, but pedestrians have the right of way there, which is just a fundamentally different way of thinking about things. Still probably a heavily car-based city, but they really centre people rather than cars. And it made such a huge difference to walking around the city.
And you can usually in a city when I travel, also from the design of the infrastructure, see if the people planning understand cycling and are themselves cycling, because some of the horrific things are in some places, of course, the result of space discussions, but also sometimes that it is from people that don't understand how you need to make it seamless, how it's so inconvenient. And I just want to give one example. I was in Australia, in Sydney, back in November last year, and I could see the changes from 8 years before when I was there. There's so much more infrastructure. There are more people cycling. There are shared bicycles. Suddenly you see it in a completely different way. And the Ramble office, I was living in downtown Sydney, I think you could say CBD. And then I had to go to the Ramble office on the other side. And of course I wanted to bike there. So I got on a Lime bike. Because of the helmet law, there was also a built-in helmet I could wear. And the sun was shining, I was cycling across the Sydney Harbour Bridge, and I was just going, oh my God, this is wonderful. And then halfway across the bridge, the e-bike turns off because I'm out of the geofenced zone where the bike can ride. And nobody communicated that to me. So suddenly I was half across the bridge on a bike with no assist. So suddenly that became not so enjoyable. So you really got to, in the design and in the communication, think about the user, because we have created cities where it's so convenient and seamless, except for congestion, to use your car.
Yeah.
So we got to do the same for walking and cycling.
So we're going to come to questions from the audience now. And I know we've got a few hundred people on the line with us. So thanks for tuning in this evening. Heaps of questions. I don't think we'll be able to get through them all. So if you can upvote the other people's questions that you would really like to see answered, that would be super helpful. Thanks, everyone. The first one I'm going to ask is from Peter Campbell. And Sandra, I might direct this to you first, but the question is, why is virtually no funds allocated to building cycling infrastructure in the Victorian state budget? Not that you're the treasurer or anything, but if there's a strategy to implement a network of strategic cycling corridors, but what do our priorities say in terms of how we allocate funds to these types of things?
Well, I think if you follow the budgets, clearly, I mean, we're an independent agency, so I'm not government. I don't make these decisions. But I think if you judge the priority on a basis of spend, clearly the priority is cars and building, roads for cars and continuing to perpetuate that. And I think that is something that we need to continue to push government to rethink. There has been an active transport working group and conversations happening with various ministers in Victoria around how to start to, change that. But it needs to be baked into the way government works. There's a number of comments in here around sort of short-termism as well. So, I think it does come down to how do we build some of these things into the planning laws? How do we make sure that, should there be a minimum percentage of spend that's sort of, expected, like the conversations we're having around a minimum percentage of the health budget spent on prevention? Should there be a minimum percentage spent on, expanding active transport and particularly cycling infrastructure? I think I think two quick opportunities, because otherwise I feel as I've been very negative, and I don't think it is at all. I as Mariana said, I mean, Melbourne is, I think, really starting to see a momentum build. I think there's an intergenerational shift as well. Young people don't have the same sort of cultural identity linked to a car as previous generations have. And I think there's a much more of an openness to, and probably linked to the deep concerns around the climate. There is much more of an openness in millennials, Gen Y, Gen Z, around active transport, public transport, and there's that culture of a car is sort of almost part of your identity as an Australian, is being challenged. I think we've also seen the last couple of years with the pandemic. Suddenly, many across Australia were living local. We realised the importance of having this infrastructure, being able to walk safely at in our 5 kilometres, or what actually was in our 5 kilometres, and how much we can live locally, and suddenly that kind of 15-minute neighbourhood or 20-minute neighbourhood concept was almost the only choice we had for a period there. And there were benefits to that I think people, not to gloss over an incredibly difficult few years, but people, I think there were learnings from that for us that we need to hold on to and take forward, that there were small silver linings that helped us to realise the benefits of local living, the benefits of investing in living at that smaller scale. And I think the third opportunity is really, we're talking a lot about federal and state government, but also local leadership. I do believe that in Australia, this is going to come from local communities, local leaders, and particularly regional centres. There are so many great regional centres now really starting to seriously look at active transport infrastructure, as we've seen the sort of tree change wave during the pandemic, people coming into regional communities looking for a lifestyle change, and an incredible amount of local leadership and innovation in regional communities, certainly across Victoria. It may be that actually, the Ballarats and the Bendigos or the Geelongs end up leading the way and paving the way for what a better transport infrastructure looks like for bigger cities like Melbourne and Sydney. It may not come out of the Melbourne and Sydneys to begin with. And I think we should be open to that and really back those regional towns and local leaders that are just getting on with it and finding solutions that work at that scale.
Yeah, absolutely. I'm just going to have to duck off to shut the door here. I can hear some noise out in the office. But I'll just pose this question to you, Mayen, before I'll be right back. Alison McDonald has asked, where would the best place be to start the transformation in Australia? For example, is it better to start with a single suburb and make it great, or start with schools or a local area or a long distance route? Where do we get started, basically?
Yeah, that's a very good and also hard question. But basically, because individuals can start from many different perspectives. It can be leisure cycling that kicks it off, or it can be commuting or shorter daily trips in general. But the point is, there has to be facilities for you to enjoy cycling. So it is first and foremost also for local governments to plan and design for people to be able to, whether it's leisure or it's commuting or shorter daily trips, to be able to do that. And I just want to add, when just talking about investments in cycling infrastructure, it is an actual investment because of the health benefits. It's actually it's a cost benefit. You get money back. And in Denmark, we calculated it. And in Denmark, for every kilometer you have a person switch from driving a car to riding a bicycle, society gains the equivalent of €1 to make it in round figures here. So that adds up to a lot of money. When you invest in car infrastructure, it's a cost for society. But so it's actually really good for local communities to invest in cycling infrastructure because of the health benefits. So it is definitely one of the starting points, that we need to have politicians who understand and also dare, because there are some resistance, of course, also against it. That's a fact. We see it everywhere. When you reallocate space from driving and give it to walking and cycling, there will be resistance. But again, it should be also framing the conversation. Why are we doing this? We don't want to take something away. We want to improve the conditions for everybody. And so it is really multifaceted. And just, I saw a question, as short one: does politicians ride a bicycle in Denmark? And the answer is yes, many do. And in front of Borgen, our parliament, there is a huge bicycle parking because cycling is so normalized that, yes, politicians also ride bicycles.
So I've got two related questions here, I think. John Neve has asked, what do you say to Australian politicians who say, well, it works over there, but it wouldn't work here? And secondly, a question from Sundance, who has said, can we discuss the elephant in the room, Australia's mandatory helmet laws? So I think there's two important perspectives there. Mayan, you're an activist for cycling, so maybe you can tackle that, and then an obvious health implication, I guess, for helmets, Sandro. But first to you, Mayan.
Yeah, it does work, because it is about designing for cycling. And I think one of the good things that came out of the horrible pandemic was actually the fact that we saw in cities around the world that suddenly need to tackle the fact that public transport was restricted, because we needed that distance between us, and nobody wanted to get on public transport, but still some people had trips that they needed to do. So we saw around the world, basically from Berlin to Bogota, that cities put up, pop-up bike lanes. And we have seen how it, again, build it and they will come. You couldn't get a bicycle basically in the world because everybody wanted to buy a bicycle, because suddenly there were less cars in the street. There were pop-up bike lanes available. You were sitting at home. You felt you needed to move. There was this huge, COVID turned out to be a huge catalyst for cycling around the world. And like Paris, we see that now it's still there. Because now they're in Berlin, in Paris, in other places, they are turning these pop-up bike lanes that were just supposed to be temporary solutions into permanent design. And if you build it, people will come, because it is actually a fantastic experience to be on a bicycle. And it's not just physical health that you, after doing it, feel that in your body. It's also mental health. There are research, and I don't want to be the health expert here, but hopefully I'm right, that, research saying that if you are active, if you cycle to work, you sleep better at night. People talk about how they just, get rid of stress on the commute home on the bicycle, whereas in the car, you just get even more, or many people do, more stressed and frustrated. So there are just so many things that you can also, as an individual, gain from this, but also there are these huge societal benefits for the livability of our cities, for public health spending. So it's also economic benefits related to this.
And Marianne, just wondering on that subject of helmets, if you've looked into this, is there any kind of research about what mandatory helmet laws do to cycling, or the benefits of having them in terms of safety? Yeah. Just if you could address that, if you don't mind.
Yeah. In Denmark, we don't have mandatory helmet laws, but we have, compared to the Dutch, a huge helmet use. It's almost zero that wears a helmet in the Netherlands. In Denmark, it is Among adults, I think it's now over 50%, and among kids, it's like 95%. But that's, voluntarily, because cities have promoted helmet use. We're just discussing that a lot in Denmark as well, because there are these links that pushing for helmets means also connotations and perceptions around cycling as being dangerous. And what we have seen around the world where helmet laws have been put in place, cycling is decreasing and dropping, and basically people stop cycling. So what I've seen in the research is that it is, relatively speaking, at least in Denmark, where we have the protected bike lanes, the risk of being injured on a bicycle is much, by not wearing a helmet, the risk for your health in general is so much lower than actually not cycling. Not cycling at all without a helmet is not that dangerous generally to your health. That is because of the health benefits. All the gains is in being active, and so the relative risk of getting hurt is very low. But of course, it depends on the infrastructure available.
Yeah. Is there anything you'd like to add to that, Sandro?
No, I think Marianne has said it well. I mean, ultimately, there are risks of not wearing a helmet, cultural elements as well from a perception, but also, I think in Australia, it may kind of almost make the discussion a layer more complicated. So I'm not sure it's a particularly helpful line to go down in Australia. I think it could just make more controversy and almost resistance to cycling if we try and bundle the two together. And ultimately, if you are going to have people cycling without helmets, as I did in Denmark, I have to admit 10 years ago, when I was living there, you need to make the infrastructure really, really safe. And it's a completely different, you're talking not just a bike lane, but you're talking a society where the default is the bicycle. The bicycle is the king on the road or the queen on the road. If you come to an intersection, I always remember, the example, if you come to an intersection, the bike lane just keeps going with a solid line, and the car actually crosses the bike lane, not the other way around. So even visually, you're reinforcing the fact that the cyclist has right of way, the cyclist is the default on the road, and the car is encroaching into the space of the bicycle. I mean, it's a completely different culture from Australia. So my feeling is that, we should really focus on getting, solid infrastructure, and we need to try and get that in a way that's protected and enduring across political cycles. 3 things that we're doing at the moment as Vic Health, as a state's prevention agency. First is we invested last year in a partnership with Victoria Walks and Bicycle Victoria in really trying to reframe the conversation around cycling, to take it away from something that, people think of getting sweaty or putting on Lycra or something that you have to have a fancy bicycle for, that actually it's not cyclists, it's people on bikes. It's just people getting out and having a good time also, ultimately as well. It's the benefits that it brings in how you feel, in the social connection, in the time in nature, in the health and mental health benefits. The second is really, I think, looking at the planning laws at the state and local levels. So we're working with now 38 councils across the state, many of them in an active partnership around how do we build localised neighbourhoods, how do we increase accessibility, how do we make it the default. So not necessarily having to kind of bring them to the health table. We're happy to come to the planning table, but there needs to be a conversation where we're linking health needs to be as important as economic and other determinants and considerations in the laws, not just a nice to have, but a need to have when you're designing new developments or new streetscapes. And the last, I think, is, there's not going to be a single silver bullet here to try and get to from where we are today. And as Mariana said, this is a kind of a culture that has built over many decades. I think it's about how do we also look at pilot sites? How do we support local leaders that are, creating neighbourhoods that work, that can be exemplars that we can learn from, so that when the politician says, oh, but Denmark's small, or oh, but Denmark's flat, or oh, but Denmark's different, it's impossible, we've actually got examples, which we do have here in Australia, that we can point to and say, well, that's not Denmark. And that's actually a growth corridor suburb where the council, the community, and local leaders have made the decision to really invest in the long term. And we're starting to see results, and these are the results. And those examples exist. And I think they're the ones we need to speak to more often than our inspiring Nordic neighbours. No offense to the Danes in the room.
So we've only got a few minutes left. Could I just get very briefly from you both, first you, Marianne, and then you, Sandro, if people are going away from this evening's talk and they want to do something, they want to take some action, what's one thing that you would encourage people to take with them out of this talk this evening?
If people in this conversation have a bicycle in a shed somewhere that needs to be fixed up, go out and do it. Maybe not tonight, but then tomorrow or the weekend. Find a wonderful area and just, get on the bicycle, start riding, and because it is really enjoyable, and teach your children, because it is something that is can follow them the rest of their lives.
Yeah, I would echo that, and particularly for young people, I think it has to start with our kids. Kind of create norms for a new generation. But I also think these are important conversations that we need to talk to our elected officials about as well. Ultimately, those that hold the power, and start at a local scale. Be involved in conversations with your local council, with local leaders, and start to drive change at a local level. It's I think that's where the change is going to happen to begin with in Australia, and it's the culmination of that, building these kind of networks of networks, and that will then achieve over time that level of scale that we're looking for.
Excellent. And a couple of reminders in the chat, people saying people walk too. It's not just cyclists. That is absolutely true. I'm not anti-walking, love public transport. All forms of active transport are fantastic. So thank you. That's all we've got time for this evening. Thank you, Marianne Weinreich and Dr. Sandro De Mayo. Thank you to Nordic Talks. Thanks very much, everyone. We'll see you next time. This episode was recorded live on Wednesday, the 1st of March, 2023, and things may have changed since recording. If you liked today's episode, please rate and review us. It helps other people to find the show. And if you love the show and want to help us continue to do work with impact and influence, please consider supporting us with a small tax-deductible gift today at australiainstitute.org.au. That's also where you'll find all our latest research and content, and we're on Twitter at the Oz Institute with an AUS. My Twitter handle is ebony_Bennett with a N-T. Marianne is at MOBIMAW, and Sandro is at Sandro De Mayo. That's DEMAIO. Our producer Jennifer Macy is at Jennifer Macy. Our theme music is by Jonathan McPhee from Pulse and Thrum, and with special thanks to Nordic Talks. Thanks for listening.